Mr. President, I was in Maine over the weekend, and people said, care, and what do you think we ought to be doing? And I said, I like the president's plan. I think President Trump has it just right. He says we need health care that will cover everyone, low premiums and low deductibles, no pre-existing conditions. That's the right formulation, and I hope that's what we can work toward, and that's what we should be working toward. He also said yesterday that the bill that passed the House was mean. Well, a couple of weeks ago, I said it was cruel, but I'll accept mean. Both mean the same thing. It's a terrible blow to millions, literally millions of people across this country and thousands in my state of Maine. And by the way, the problem with the House bill is it's so bad that some kind of compromise that's developed here that's halfway is still mean or cruel. And now people are talking about a soft landing. That's a euphemism for stretching out the crash. It's not a soft landing. Whether you take Medicaid and health care coverage away from people in 2 years, 4 years, or 7 years, it's still going to happen, and it's a crash. It's not a soft landing. That's just stretching it out into beyond the next couple of elections. But that doesn't really get to the core of the issue, which is taking health care and health insurance away from millions of people. By the way, before I began, I meant to acknowledge what happened this morning to our colleagues across the way at the baseball practice. Tragic, inexplicable, horrible, and just inexcusable. My heart goes out to the Capitol Police, who I understand were incredibly brave and met their responsibilities admirably, to Representative Scalise and to any others who were injured. A terrible incident, and one that we hope we never see the likes of again. Let me go back to health care. I think it's important for people to understand the big picture of what's going on in this issue that's now before both the House and the Senate. What we're really talking about is a massive tax increase on middle class and lower middle class people, and a massive tax cut for the wealthiest Americans. It's as simple as that. It is a gigantic transfer of wealth, probably one of the greatest in a short time in recent American history, where you have millions of people across the country who have health insurance under the Affordable Care Act and are protected under Medicaid and Medicaid expansion, and you're taking that away. And the Affordable Care Act exchange policies are a tax credit. So when you take that away, you're increasing people's taxes. You're increasing people's taxes who are making between $15,000 and $45,000, $60,000, $70,000 a year, and you're decreasing taxes in a huge way only for people who make more than $200,000 a year. The 400 highest taxpayers in the country will get a $7 million apiece tax cut. That makes no sense. We are taking resources away from the people who need it, the middle class, and we're giving it to the people who don't need it. It's Robin Hood in reverse. And that's the fundamental point of this legislation. It's all about that big tax cut for the rich, for the really rich. And I just don't understand why we're even thinking about that, because the American people need help with the cost of health care. The average, if you divide the total health care bill in this country by the number of people, you come up with about $8,500 a year per person. $35,000 a year for a family of four. That's the cost of health care. That cost has to be paid. And I would argue that people who are in the middle income can't afford it. They can't afford to pay those costs. And they need some help. And that's what the Affordable Care Act does. But instead, we're talking about repealing it, knocking those thousands, millions of people off. In Maine, we have 75,000 people on the exchanges. And then, of course, we have hundreds of thousands on Medicaid. We're talking about severely constricting their access to health care. And that's just wrong. Ethically, morally, in any other way. We are taking health care away from people so we can give a massive tax cut to the people who don't really need it. In Maine, If the House had taken a blank sheet of paper and said, how can we design a health care plan that would really hammer the people of Maine, it would have been the AHCA, misnamed American Health Care Act. It ought to be the Anti-Health Care Act, because that's what it's all about, is taking health care away from people. It could not be more tailored to harm people in Maine. We are the oldest state in the country. We have more people in the older age brackets, 50 and up, than any other state in the United States, as a percentage of our population. We also are a relatively low-income state. You put those things together, and you really get hurt. And also in Maine, as in the presiding officer's home state, we have a lot of hazardous occupations: logging, agriculture, fishing. The iconic Maine lobsterman. This is a guy named David Osgood from Vinyl Haven, an incredibly beautiful island off the coast of Maine. Lobstering is an essential part of the Maine economy. It's a part of our way of life. Vinyl Haven, where David lives, has a population of about 1,200. It's really hard work. It's all weather. It's dangerous. You got to haul tracks, repair them, be out on the water in the wintertime, which is no fun. And David Osgood has been lobstering since he was 13, like his father and grandfather before him. As of this spring, all three of David and Elaine's children have finished college. That's amazing. That's a real achievement for any family. But fishing is challenging and tough. The Osgoods are really thankful for the fact that they can get affordable health insurance through the Affordable Care Act. Once, they weren't covered. And David had a back problem, required surgery. Like a lot of people in Maine, he paid it off, month by month by month. But the ACA, according to Elaine, has given them some comfort and peace of mind. And those of us who have pretty much had health insurance all our lives, I don't think realize the importance of that peace of mind, of not being anxious about a health problem that could wipe you out, make you lose your house, an illness or an injury. Elaine said, we'll be okay. The deductibles are a problem. They're too high. I agree. That's what we ought to be working on, is how to get the deductibles down, how to work on the premiums, how to work on the cost of health care. Because all this debate about the Affordable Care Act and Medicare and Medicaid and public option and single payer, all of that is about who pays, when a big part of the problem is how much we're all paying. We pay roughly twice as much per person for health care than anyone else in the industrialized world. And that's a real problem that we have to start debating, Mr. President. We have to start talking about that, because whoever pays, whatever the insurance plan is, if the underlying cost is something that people just can't afford, then we're going to be just arguing about who pays how much and what part. But we have to get at that $8,500 per person. And people say, yeah, but we have the best health care system in the world. Yes, we do, for the people that can afford it. But for the millions of people that don't have health insurance, that only get treated in emergency rooms, or more often don't get treated at all because they don't want to go in because they know they can't pay for it, the health care system does not deliver for them. And by all the objective measures, longevity, infant mortality, all of those measures, we're not first in the world. We're like 20th in the world. We are way below our colleagues, and yet we're paying much more. We've got to address high deductibles and high premiums and high costs. But we also, in the meantime, have to keep people covered. Another couple in Maine, Jonathan Edwards and Jennifer Schroth, live in Hancock County. It's another coastal county. They're farmers, and they raise vegetables. And here's a great Maine story. I've known Jen's mother for about 40 years, and I just met Jen at a healthcare forum in Bangor a few weeks ago. But I knew her mother way back along. Everybody in Maine knows everybody else. I suspect it's like in Alaska. We're a big, small town with very long roads. Jonathan and Jennifer own and operate a farm. And by the way, this farm is in a town called Brooklyn, but this is the real Brooklyn, Maine. They grow potatoes, vegetables, make maple syrup, strawberries, raspberries, asparagus. They could never afford health care until the ACA came along because they were essentially a small business, but they weren't a big enough business to have a group plan. They didn't have employer-based health insurance. They just didn't have it. But they're both in their 50s. And one of the changes made in the House bill is that under the Affordable Care Act, the ratio between the premiums for younger people and older people can't be more than 3 times. It reflects the reality that older people have more health care needs and cost the system more, so there is a reflection. It's allowed to be a 3 times basis. The House bill changes that to 5 times. That's a huge shift directly toward people in their 50s and early 60s. When Jen was pregnant with each of their 2 boys, they had no insurance. They paid the hospital, just like my friend David Osgood. They paid the hospital. That's what Maine people do. But what if there had been complications? They were pretty straightforward births. What if there had been complications? They would have been wiped out because they had no health insurance. Jen says she doesn't feel it's responsible to go without health insurance, especially when you have a family. It's critical to them that the ACA is affordable, and it is because of the tax credits. And they also appreciate that they've got real insurance that really covers things. There are no exclusions. You know, people say, well, I have this really cheap insurance policy, but it doesn't cover anything. It may not even cover hospitalization, or doesn't cover doctor's visits, or doesn't cover drugs, doesn't cover what you really need. That's not insurance. That's illusory. But now, Jen says they have peace of mind because they have coverage. She told me that face to face not long ago. Running a small business is tough. It's tough because you generally can't get group policy. Sometimes you can join a small business association, but generally you can't. And this is a way to have coverage that people can afford. Imagine if somebody came to this body and said, I have a great idea for a bill. I'm going to raise taxes on the middle class and give a great big break to hedge fund managers. We wouldn't even think about it. It wouldn't even get out of committee. And yet, that's essentially what this is all about. How much of a tax increase on somebody? Well, in Hancock County, where these folks live, 60-year-old making $40,000 a year. These are real numbers from the Kaiser Family Foundation. Under the Affordable Care Act, your premium's $4,080 a year. $4,080 a year, about 10% of your income. That's still substantial. But under the bill passed by the House, that would go to $17,090 on a $40,000 gross income. That's ridiculous to go from $4,000 to $17,000. And where does that difference come from? It's going back to the people that don't need it. It's going back to the people that make $200,000, $400,000, $800,000, $1 million, $5 million a year. A 300% increase in out-of-pocket costs for health care. In Knox County, David, my lobsterman friend, I think he's younger than 60, but if he were 60 and making $40,000, to keep the example the same, his premium would go from $4,080 to $10,590, more than double. Mr. President, this just doesn't make sense to me. This whole discussion doesn't make sense to me. I agree that we need to talk about health care, and I agree that we need to do something about it, but we're doing the wrong thing. We're making it worse. There are 2 problems with health care in this country. You can boil it down to 2 issues: cost and access. The Affordable Care Act, although it dealt somewhat with cost, was mostly about access, allowing people who don't have health insurance to get it, whether through Medicaid expansion or through the exchanges. Cost is a bigger issue, and it's one that we also have to deal with, but that's not what's on the floor now or soon, and it's not what is being considered in Congress, but I would argue we've really got to pay attention to that issue as well. So, all of this, taking coverage away from my friend David or Jen and John, and thousands, well, we know the number from the House bill, 23 million people in America, 23 million people, to give a massive tax break so a guy making a couple of $1 million a year can buy an extra Maserati. It just doesn't pass the straight face test for good public policy. I am the first to agree that the Affordable Care Act's not perfect. I think there are things about it that need to be fixed and adjusted, and we need to work about how do we do the deductibles and how do we improve that, and how do we broaden the coverage and maybe make it more of a sliding scale. All of those things are things we can discuss and work on, and I'm absolutely willing to do it. But the idea of repealing it just to check a box and to meet a campaign promise and to be so divergent from what the president has said over and over and over in the campaign and since that time, that he wants coverage for everyone, no pre-existing conditions, and lower premiums and deductibles. I'm for it. But what we're doing is the exact opposite. The exact 180-degree opposite. So let's take a breath. There's no deadline here of next week or the July 4th recess. Let's take a break and back off and start talking about it as senators and representatives from all over the country, all parties. I think we ought to be able to come to some agreement here. Now, if there are people who are just hell-bent to provide a tax cut to multimillionaires, then there isn't an agreement to be had. If that's got to be part of the deal, include me out. But if we can start talking reasonably about how we can improve the Affordable Care Act, and I don't care if we improve it, change it, tinker with it, and call it Trump Care, or McConnell Care, or Ryan Care, call it what you want. But let's provide health insurance that's so important to the American people. And Mr. President, I've told this story a couple of times, but I'm going to conclude with this, why I'm so passionate about this. 40 years ago, I worked here. I was a staff member, and I had insurance. For the first time in my young life, I think, I had health insurance, and part of the health insurance was a provision for preventive care, which is also required under the Affordable Care Act, so you could have a free physical. I was 28, 29 years old and immortal. We all were at that age. But I said, what the heck, it's free. I guess I'll go and have a physical. So I went in and had a physical, and the doctor looked me over and looked in my eyes and down my throat, but he happened to notice on my back I had a black mole. He said, I don't like the looks of that. That ought to be taken off. I didn't even notice it. I didn't even know it was there. They took it off. It turned out to be something called malignant melanoma, which is one of the most virulent and serious forms of cancer. And the thing about malignant melanoma is if you catch it in time, you're good. Here I am 40 years later. If you don't, you're gone. And I've had friends in Maine and other parts of the country who've died of melanoma. And it's always haunted me to this day that the only reason I caught it and my life was saved was because I had health insurance. And that somewhere in this country there was a young man who also had a mole on his back or on his arm or on his neck, who didn't have health insurance, didn't have preventive care, didn't go to the doctor, and he's gone. That's not fair. That's not right. In a country as advanced and wealthy as this is, it's not right that that guy died and I'm here. And so don't ever tell me that health insurance doesn't save lives, because it does. There is no doubt that it does. And that's why this is so important for us to get this right and not just cavalierly and blithely rip health insurance away from people, many of whom have gotten it for the first time, many of whom are small business people, the very people we all talk about wanting to help. We can't do it it's a dereliction of our duty to serve the American people. We need to figure out how to do it right. We need to figure out how to do it effectively and efficiently. But in the end, we're here to help our fellow citizens. I'm here for Maine, and I can't let my people suffer under a law that would take something away that they've come to depend upon, that has saved lives and means so much to them. We can do better, Mr. President. I'm sure of it. Thank you. I yield the floor.